Welcome everyone. So today let's learn about diagnosis of pregnancy. So in this chapter we'll learn about the different diagnostic methods and trimester specific changes in pregnancy. So let's quickly dive in. Okay, so starting off with the pregnancy test or different diagnostic method of testing pregnancy. The first is the ELISA test. This is most commonly done and it can be done at home. So this is to detect HCG in urine. Okay, the sensitivity is 30 to 50 milli international unit per milliliter. Now what does this mean? This means that in per milliliter of urine, if there is 30 to 50 milli international unit of HCG, then ELISA can detect pregnancy. Okay, so if it is less than 30, it will not be able to detect pregnancy. So the result is 4 to 5 minutes, and it can detect pregnancy 2 to 3 days after missed period. Okay, so that is why I said ELISA test is like if the mother is at a very initial stage of a pregnancy, ELISA will not be able to detect pregnancy. It will show a negative, and even though the woman is pregnant. Okay, so that is why it can detect pregnancy 2 to 3 days after missed period. That means almost a month or more than a month. So the second one is the lab test, where you have a immunoassay test, and it is the most sensitive test. Okay, and it can detect pregnancy 8 to 9 days after ovulation. Okay, and this takes little longer time, which it takes 3 to 4 hours. Okay, and then you have a latex agglutination test, which is it gives the results within 2 minutes, and here if there is no agglutination, then it means the pregnancy is positive. Okay, so let's see the objective signs of pregnancy in first trimester. Let's see first in breast. So the changes in the breast. There is going to be an enlargement of the breast with visible vein under skin by the time she reaches 6 to 8 weeks of gestation. The breast enlargement is more prominent in primigravida than in multigravida. Okay. Number two, there is going to be a uh, uh, nipple and areolae are more pigmented, and number three, Montgomery tubercles are more prominent. And then number four, by the time she reaches 12 weeks of gestation, there is an expression of colostrum also. And in cervical and vaginal sign, there is going number one, it is Jacquemer or Cadwick's sign, which is a bluish discoloration of vagina. Number two, it is a Goodell sign that you'll see, which is the cervical softening. And number three is Osiander sign, which is an increased pulsation in the lateral fornix of vagina. Okay, you'll feel that pulsation while doing bimanual examination. And then you'll also have a and in uterine sign, the size progresses. Okay, by the time the woman is 6 weeks, the uterus size is of egg size. By the time she is 8 weeks, it is of cricket ball size, and then by 12 weeks, it is the size of a fetal head. So number two, it is a Heger sign. Heger sign is a softening of a uterus body and the cervix. Okay, and number three, there is you'll see palmar sign, which is a rhythmic uterine contraction during and you'll feel that contraction during bimanual examination, and this sign you usually see between 4 to 8 weeks of gestation. Okay, so let's learn about the second trimester features, which is 13 to 28 weeks of gestation. So first is the quickening. You first feel the fetal movement by the time the mother is 18 weeks of gestation. Okay, in primi mother, and in multi gravida or multiparous mother, it is 16 weeks. Okay, and it is useful for calculating EDD. And how do you calculate this? We'll learn in later on in other slide. Number two, you'll start hearing fetal heart sound. Okay, it is audible with ordinary stethoscope by the time she is 18 to 20 weeks of gestation. Okay, so normal rate of FHR is 110 by 160, and it is the most conclusive clinical signs of pregnancy. And then you have fundal height. So uterus midway becomes between pubic and umbilicus at 16 weeks. At umbilical at level it is 24 weeks, and there is a progression of abdominal enlargement visible. And what are there are certain important physical signs. That is, one is chondrosma, which is the facial pigmentation, the dark pigmentation on the face, which appears around 24 weeks of gestation. And then you'll also see linea nigra, which is the dark line from the pubis to the sternum. And then a secondary areolae, it appears around 20 weeks of gestation. And then you can also feel external ballotment. Okay, the fetus can be when you do this examination, the fetus can be displaced in the amniotic fluid by the time she is 20 weeks of gestation. Coming to third trimester features, which is 29 to 40 weeks of gestation. In maternal symptoms, there will be a progress in the abdominal enlargement. And there is going to be a mechanical discomfort, which is palpitation and dyspnea. There's going to be a lightening, which is the head is going to get engaged in the pelvis, which is descends in the pelvis. Hence relief of pressure symptoms around for 38 weeks is felt. Okay, and number 4 is there is going to be a return of urinary frequency, and then more pronounced fetal movement will be felt. Then in fundal height changes, 32 at 32 weeks, the fundus will be at the upper third between umbilicus and sternum. In 36 weeks, it will be at the level of ensiform cartilage, which is at the sternum. And at 40 weeks, it returns back to 32 weeks of 32 weeks level, because the head gets engaged in the pelvis. Okay, it gets descent in the pelvis. Symphysis fundal height, after 24 weeks of gestation, symphysis fundal height in centimeter equals to week of pregnancy. So we do a fundal height check to check the gestational age. Okay, so plus minus 2 centimeter variation is normal. Okay, so the key physical signs are uterine shape changes from cylindrical to spherical after 36 weeks, because of lightening. Okay, so once the from 36 weeks it gets lightening, the head gets descends to the pelvic, and it from the cylindrical shape it becomes spherical shape because the flank gets fuller. Braxton Hicks contraction becomes more evident in third trimester, and easy identification of fetal lie, presentation and position when you do abdominal examination. Okay, so let's see what is classification of pregnancy sign. So there is absolute sign, there is a probable sign, and there is a presumptive sign. So what is absolute sign? It is a and signs are diagnostic and cannot be attributed to any other condition. It is absolute and it is 100% true. Okay, and probable sign are a sign that are objective, that you can see. Okay, but may not have any other causes. And what is presumptive symptoms that are subjective, what the client is saying, and are least reliable. So in the absolute sign, you will be able to feel the fetus part. 2, you will be able to hear the fetal heart sound, and through ultrasound also it is going to be evident, because by the time it is 6 weeks you'll see the embryo, and through x-ray also the fetal skeleton also can show that the pregnancy is absolute or positive. So in probable sign, they can be uterine enlargement, and they can be Braxton Hicks contraction, ballotment, cervical changes, Hager or Goodell sign, and positive pregnancy test as well. Presumptive symptoms are amenorrhea, morning sickness, urinary frequency, breast changes, quickening, and fatigue. Lastly, let's learn about how to calculate gestational age and EDD. Okay. First is LMP. LMP will help you give you the EDD estimation, that is expected delivery date. First, you need to ask the mother her LMP, the date plus 9 months plus 7 days. Okay, that will give you the EDD. And then through ultrasound, the first trimester ultrasound that has been done will give you the baby's gestational age. Through clinical parameters, the quickening will give you the EDD and fundal height will give you the gestational age. So from the date of the quickening, the first quickening that the mother felt, you need to add 22 weeks from that day or date, that you need to add 22 weeks. That will give you estimated delivery date if it is primary gravida, and if it is multigravida you need to add 24 weeks. Okay. Fundal height is like after 24 weeks of gestation, um, uh, every 1 centimeter corresponds to 1 week. Okay, and plus minus 2 centimeter of variation is normal. Number 4, this is Johnson formula. This will help you to calculate the fetus weight. So here what you need to do is you need to first measure the fundal height. Okay, once you measure the fundal height, you need to minus 12 if the head is not engaged. That means the head is still above the ischial spine. Okay, or you need to minus 11, which is from the fundal height you need to minus 11 if it is below the ischial spine. Okay, into 155. That will give you the fetus weight in gram, and this is very useful for planning for delivery. Okay, and just note, when the ultrasound and LMP differs by more than 10 days, then you need to use ultrasound date for EDD calculation. Okay, so thank you so much. If you like it, please do share with your friends and do not forget to like and subscribe.